Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Desvenlafaxine. Its brand name is Pristiq. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it really helps me with the YouTube algorithm. So what will we cover in this presentation? First, we're going to talk about how Desvenlafaxine works. We're going to discuss indications or reasons we would prescribe this medications to patients, then contraindications or reasons we could not prescribe this medication. We'll touch on examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Desvenlafaxine work? So it's a selective serotonin and norepinephrine reuptake inhibitor, also known as an SNRI. It potentiates these neurotransmitters' activity in the central nervous system. And it should be noted here that desvenlafaxine is the major active metabolite of venlafaxine. Now, in terms of indications or reasons we would prescribe this medication to patients, the only on-label indication would be in major depressive disorder, or MDD. Now, in terms of contraindications or reasons we would not be able to prescribe this medication, the first one would be if a patient had a hypersensitivity or allergy to desvenlafaxine, venlafaxine, or any other component of the formulation. They would also not be able to use this medication if they used a monoamine oxidase inhibitor in the previous 14 days. Now for some examples of dosing with desvenlafaxine. So as we said, major depressive disorder. In this indication, we would typically give 50 milligrams once daily. And an off-label indication would be in menopausal flushing, in which case we would give 100 milligrams orally once daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using desvenlafaxine. So I'll go over some of those here now. First off, diaphoresis or profuse sweating may happen 10 to 21% of the time. 3 to 10% of patients may experience a rise in their serum cholesterol. 1 to 6% may experience a rise in their serum triglycerides. 9 to 14% of patients may experience constipation. And a decrease in appetite may happen 5 to 10% of the time. 22 to 41% of patients may experience nausea, and vomiting comes in at a rate of 3 to 9%. Xerostomia, or dry mouth, may happen in 11% or 25% of patients, and dizziness may happen between 10 and 16% of the time. Insomnia comes in at a rate between 9 and 15%, and 4 to 12% of patients may experience somnolence. Blurred vision may occur 3 to 4% of the time, and anxiety comes in at 3 to 5%. 3 to 11% of patients may experience erectile dysfunction, and 7 to 11% may experience fatigue. Now, some more rare but serious side effects with desvenlafaxine would be hypertension or high blood pressure, a seizure, this would happen less than 2% of the time, suicidal thoughts, or serotonin syndrome. That's all we're going to talk about today with desvenlafaxine or Pristiq. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.